Dystrophy, autoimmune polyendocrinopathy, candidiasis, ectodermal, a genetic autoimmune disease with an extraordinary array of clinical features but characterized most often by at least two of the following three findings: hypoparathyroidism, underfunction of the parathyroid glands which control calcium; candidiasis, yeast infection; and adrenal insufficiency, underfunction of the adrenal gland. APOC was the first systemic body-wide autoimmune disease found due to a defect in a single gene. By autoimmune is meant that the immune system, which normally wards off foreign invaders of the body, turns and attacks tissues such as skin, joints, liver, lungs, etc. of the body. Examples of common systemic autoimmune diseases include rheumatoid arthritis, systemic lupus erythematosus, diabetes mellitus, Sjogren's syndrome, scleroderma, Goodpasture syndrome, vitiligo, Addison disease, thyroiditis, and many others. In 1997, a novel gene was identified that linked to chromosome region 21q22.3. The gene was named AIR for autoimmune regulator. Changes in the AIR gene are responsible for APOC. APOC is inherited as a recessive trait such that a child with the disease has received two changed mutant AIR genes, one from each parent. Although APOC is generally rare, it is more frequent in three genetically isolated populations: the Finnish, Iranian Jews, and Sardinians. The child with APOC develops problems in numerous glands polyglandular, including hypoparathyroidism, hypogonadism with sex gland failure, adrenal insufficiency, type 1 insulin-dependent diabetes with insufficient insulin production by the pancreas gland, and latent hypothyroidism, underfunction of the thyroid gland. Other features of APOC are total baldness, alopecia totalis, inflammation of the cornea and whites of the eye, keratoconjunctivitis, underdevelopment, hypoplasia of the enamel of the teeth, childhood onset monoliasis, yeast infection, juvenile onset pernicious anemia, gastrointestinal problems, malabsorption, diarrhea, and chronic active hepatitis. The laboratory studies in APOC attest to an immune disease with an abnormally low level of gamma-globulin antibodies in blood, hypogammaglobulinemia, and an abnormally low T4/E8 white blood cell ratio as in AIDS. There is specific evidence for autoimmunity with antibodies directed against the adrenal and thyroid glands and against cell nuclei, anti-adrenal, antithyroid, and anti-nuclear antibodies. The treatment of APOC is directed at treating the specific problems, replacing the various hormones that are in short supply, giving insulin for the diabetes, treating the yeast infections, etc. However, there is no known cure for APOC.